All right. Hi, everybody. Good afternoon. If you are able to, I would appreciate everybody turning their camera on. If you really, really don't want to, you don't have to. But this little virtual coffee break is a way for us to kind of get to know each other a little bit better and a little bit more personally, outside of our professional relationships that we have with each other's organizations. So we're going to take just 1 minute or two and go through and just introduce ourselves, just name organization you work with, and then I'm gonna turn the floor over to Matt. So actually, I'll let him be last. So I will start with Kelly.
Hi, everybody. I'm Kelly Buellin with the Eastern Shore Community Services Board and Secretary of Community Partners of the Eastern Shore.
Wendy.
Hi, I'm Wendy Ainsworth with the Virginia Department of Veterans Services here in Accomack.
Jessica.
Hello, I'm Jessica Bonnewell, Director of Quality with Eastern Shore Rural Health.
Kyle.
Kyle Falk. I'm with No Limits Eastern Shore Brain Injury Services.
Jamie.
Hi, I'm Jamie Replogle. I'm the new Workforce Service Office Manager here at the VEC and Only.
Robin.
You're muted, Robin.
Robin Sexauer, Department of Rehab Services, Vocational Rehabilitation Counselor.
Sadia.
Sadia Davis, Program Support Technician with the Accomack County Health Department and NFP program.
Ann.
Ann Wessels, Department of Corrections, District 4 Probation and Parole.
Great. Good afternoon, everybody. I'm Sharman Horton. I am the Prevention Coalition Coordinator for Eastern Shore Community Services Board and the Chair of Community Partners of the Eastern Shore. Again, if you can turn your camera on and you're okay with that, please do so. If not, I totally understand. I am now going to turn the floor over to Matt Clay, the Chief Executive Officer for the Eastern Shore Rural Health Services. And we're going to learn a little bit more about Matt and why he's on the Eastern Shore and what brought him here. Matt?
Hey, you want the Cliff Notes version or you want the long version? So,
well, you've got a good 25 minutes. Do what you need to.
So I'll give a little bit about my background and real quick, if you guys can see my lovely family back there, those are 5 of my children. I wanted 6. I tell people frequently I wanted 6, but my wife and I had a very short conversation about that. And I'm still trying to get Jessica to agree with her husband to have more than 1, but no, I think it's great. But so I came from Southwest Michigan, the very southwest corner of Michigan, the very county right there. Born and raised there, grew up on a family farm. Very similar to here as far as how rural it was growing up. But started out my life, my career was in education. Decided I got tired of being rich. So I got into healthcare and decided I got tired of being rich too. So it's been good. But I back in 07, 08, when the economy tanked a little bit, it was a good time to get out of education and had opportunity to go work for the tribe that I'm a tribal citizen of. And during my tenure as a teacher, I got my master's degree in information technology and went to work for the tribe, knowing that a little bit that probably within half a year or so, that they would have a director of IT position open up. So I started out working with them doing training and development. Within 7 months, I became the director of IT for the Pokagon Band of Potawatomi Indians. And I'll tell you a little more about them in a second. So I did that. I got on board with them, became director of IT there, revamped a lot of things, created a lot of structure, put a lot of systems in place. During that time, I volunteered to be on the Tribal Health Board, which was exciting. Got to learn a little bit about healthcare at the time and population health, especially in Native American communities. And from that point, about a year later, I became chair of the board. Well, the day I became chair of the health board, they fired my coworker who was running the health department, which was a challenge to say the least. So they tried filling that position for about a year. Tribal council had 2 or 3 different people that just didn't work out. So the government manager and tribal council came to me and asked me to take over that position as the executive director for health services for the tribe. At that point, I said, this is not my background. This is not what I've done. But I was involved a lot through being the chair and also working there. I told him I would do it for 90 days and see how it went, and not to fill my previous position. And the rest is history, so to speak. We started out with a 4,400 square foot Sears brick building, 3 exam rooms, 2 of which did not have running water. I convinced tribal council to build a 37,000 square foot state-of-the-art healthcare facility. At that time, we added dental, we increased our behavioral health, and expanded our pharmacy. So it was challenging to say the least, and we started growing significantly as far as our numbers and our patient visits. And from there, we expanded further. You know, that building was meant to last 5 to 10 years. 2 years later, I went back and said we need to expand based on the growth. We added another 30,000 square foot facility, expanded 2 more satellite facilities, and shortly before I came here, we added a 4th facility to serve the community. But Indian Health Services is very similar to what we do here at Eastern Shore Rural Health. Federally qualified health centers are very similar to Indian Health Service health centers, and so that an IHS facility is considered an FQHC lookalike. But so that's kind of what brought me here. But before I go on any further, if anybody have any questions about that kind of the history to how I got here, again, that's pretty quick version, but it was it's been a great journey. Okay, hearing none, so I'll move on to my transition, moving from there to here. So I'm assuming everybody loves politics, and I really cannot stay in politics. I don't like to be involved. We all know that politics at the federal level right now is a little toxic. So to kind of put it in perspective, anything you see at the federal level does not hold a candle to tribal politics. Tribal politics is probably one of the most challenging things I've ever faced. But so that's what caused me to want to start looking for something else. I had hoped to retire serving our people there at the Pokagon Band, but it got very toxic. And at the end, when I left, we had no government manager, we had no assistant government manager, no director of HR, no director of communication, no director of education. And I think there was a couple others. So that kind of speaks to the toxicity that was going on. And my wife and I started looking. So we had, prior to taking this job here, I had 5 other opportunities, and we fell in love with the shore. We fell in love with a community that would, help us raise our kids, and so to speak. And that was a big driving force for us. Really loved the board here. The staff that I got to meet with when we interviewed was, I thought, phenomenal. I still think they're phenomenal. It was a great opportunity to move and do something exciting. So we love it here. We've been here for 16 months now. It's hard to believe. And exciting things are coming. We're excited about what we're doing. We're excited to be here. My kids have acclimated very well. My wife is happy. Happy wife, happy life, so they say. And but again, it's been very good. Trevor, what else would you like me to talk about? I can get into some details of what we're doing with Eastern Shore Rural Health if you want.
You could definitely do that. You could tell us what you like to do in your spare time if you have any. What else you do in the community? Anything you really want to talk about? What if you didn't know you, what would you want to know about you?
Well, I'd like
wife makes
a stylish haircut, but it's so I've been involved. I think it's very important to be involved in the community, and not just because of the role that I'm in. So prior to coming here, I served on our township board. I served on our school board, hospital foundation, the college foundation, YMCA. I mean, a lot of things, because I think it's important to be involved. I kind of kid, because I told my wife I wouldn't do as much when I got here. Since then, obviously I'm involved with Rotary, with the Chamber. I'm on the board of directors for Habitat. I'm on the state board association for primary or for community health centers. I'm now on the Synivia board, which is our credentialing and billing services at the state level. And I'm on 3 national committees with NAC. So that's exactly what I wasn't going to do, but so in my spare time, what do I like to do? I enjoy the water. I tell people Michigan is just like the shore. We're surrounded on 3 sides by water, and you just got to go a little further. I grew up 10 minutes from Lake Michigan, so we spent a lot of time there, as well as growing up fishing, water skiing, doing a lot of things like that at inland lakes. But in our spare time, we bought a boat last spring. I would say we probably use it 3 or 4 or 5 days a week last year, and I hope to do that again this year. But and the other thing, I enjoy woodworking. I enjoy doing that when I have the time. But again, there's not a lot of time to do that. But what else about me? I think I'm a pretty simple guy. I'm not overly complicated. I try to keep life simple. And I'm fortunate to have good team members like Amy and Jessica around me that support what we're doing. I believe, there's a great call to serve, and I think this is a good community to do that. This is one of the most active communities I've been around. And I tell many people from Michigan, and they say they can hear it in my voice. We love where we're at. When we went back to visit in July, my wife and I both said the first day, we're visiting, and home is back in the Eastern Shore. But small town America is ideal location to live and raise kids. And I feel like this is one of the last sweet spots we have in our country. But what else do I like to do? Enjoy spending time with my kids and family. Obviously, I think that's very important. My wife is my best friend, and I try to, and have since we've been married, try to spend one night a week going to a movie or dinner or something like that, which can be challenging with 5 kids and all the other events we have going on. But what else do I like to do? I enjoy fishing. I enjoy hunting. I just don't have as much time to do that as I once did. But trying to think what else there is. How many questions you guys have? Don't everybody jump at once.
I know, right? No questions. Nobody has any questions about the elusive brand new Matt Clay? Come on now.
I'll ask a question. Matt, what is your vision for the next, say, 5 years for healthcare on the Eastern Shore?
So overall, I'll give you 2 levels of that. I think overall healthcare is going to be challenging, and I think we're going to see more and more struggles with that, because we're going to see they're predicting by 2025, 27, something like that, a 225,000 provider shortfall. So that is significant for our entire country. So I think, I'm trying to, as an organization, put things in place to help us, a couple things, serve our community in a great way, expand services as we can, but sustainability is very important to do that. And as we know, this past year, consumer price index has gone up 7%, and the average American got a 3%, wage increase. So there's issues there. So in order for us to be competitive, we have to find unique ways to generate revenue outside of just, provider care. And we're looking at some of those ways right now as we speak. But I think it's important to increase services. We also need to increase dental services. As you guys are well aware, with CSB, there's not enough mental health anywhere in the country, let alone on the shore. And really to partner with our partners and grow what we do here on the shore. I think we have an opportunity to do some things. One of the things that I have not announced yet, I'm trying to put in place, and I've been meeting with some CEOs, is to do the first annual CEO summit with all the CEOs and presidents here on the shore to try to look collectively as a community how we can improve things. And I think that's important. Having not been involved but for the last 16 months, there's a lot of great organizations, but sometimes I feel like they're siloed. And if we can start all moving in the same direction, I think we can see significant impacts. But healthcare is challenging, as you guys are well aware that are in the industry. But, those are some of the things we're looking at from an organizational perspective, trying to maintain and keep staff. I think that's important. My number one goal, as I said when I interviewed here, is taking care of our people. If we can take care of them, provide them the tools they need, anything they need for success is important. But there are obviously significant pitfalls here on the shore in terms of what we need service-wise. And again, one of the things that I've been told, we service 70% of the people here on the shore. That's great, but we still need to improve customer service and patient care. And, I want to expand that. I want to expand to other areas, especially dental. There's such a significant need here on the shore. Outreach services are important as well. And Jessica's well aware of that. And, so all those things, what barriers do we have to patient care? And I have a whole list on my board, a big project list, of things that I'm looking at. But it takes a team and it takes time, But I appreciate the question. Does that answer your question, okay, Kelly?
Yes, it does. And actually, I would love to have a conversation with you, and you can address a little bit of it here. One of the things that we talk about a lot in our substance abuse treatment department is the number of patients that we see who have significant dental issues that prohibit their recovery or endanger their recovery every day. And I was wondering, in your vision, do you foresee any type of specialty dental services like treating patients with severe substance use disorder?
I think that would be great, Kelly. I think we got to, we want to get to those things. Again, right now we're trying to build the foundation. When we can't meet the capacity for what we have already, it's hard to expand some of that, but we are pushing hard to do that. We have now expanded to Northampton County schools as well, but we're looking to, again, this is not great public knowledge, but we're looking to possibly expand and add a dental center and only, whether it's connected to our building or somewhere else, important, but we would love to do that. We did that at the tribe, and there's such a huge impact emotionally from somebody that has, horrible teeth to having improved, oral health. So yes, that would be something we would love to do.
Right. I know the two things, and I'll get off of this because I don't want to dominate your time and everybody else's time, but with our mobile unit, having a mobile dental clinic, I know some other areas that are doing that to specifically treat people with serious mental illness and substance use disorder, but also the consortium that Rural Health, you and the Community Services Board sits on for telemedicine as well as substance use and addiction treatment. I would love to, I want to encourage and nudge that group to begin looking at things like that, paying for dental care for certain populations and opening some avenues for people that wouldn't have them and help Rural Health, expand that service as well.
No, I agree, Kelly. And it's frustrating because there's a lot of money there with the Bay Rivers Telehealth Alliance. There's a lot of money. It's pretty prescriptive on what we can use it for, but by all means, let's set up a time to meet and discuss it further, because any services we can provide, we want to do that. Again, I always talk about sustainability, but first and foremost, we want to provide services that we need here on the shore.
Yeah, absolutely. And kind of begin thinking outside the box instead of that prescriptive response like you mentioned. I'm all for that. So thank you for entertaining my questions.
No, not a problem. Anybody else?
I've got something to add on the dental part. I work for the Veterans Services here in Accomack, and a lot of people don't realize that the VA actually offers very little dental health to veterans. And it's mainly like people who are 100% disabled. So you have a lot of people that are not 100% disabled, but still have a lot of dental needs. And a lot of people just think, well, the VA provides that, and that's not the case.
Wendy, let's talk more, because one of the things that, I haven't had a chance to get to it yet, but one of the things we did at the tribe is we had a partnership with the VA, and we could see all VA patients at our centers and they would reimburse us, and I think that would be significant to do that. And I know there's a 14-15% VA population here on the shore, so again, that's not only convenient, but if there's services we can provide that are not provided, we would definitely want to do that. So I would like to chat with you on that. Okay. Really, I don't know the counterparts yet, but like I said, we did this in Michigan with our tribe in the VA, and it was a great program. So I'm definitely open to that. So I appreciate bringing that up.
I'd love to talk to you about that. Yeah,
that would be great.
Does anybody have anything else for Matt? Does anybody have anything else they'd like to say, comment on? Is there anybody else that you would like to see us bring to our virtual coffee breaks in the future? All right, then. Well, Matt, thank you very much for being here. We greatly appreciate it. Today's surprise winner is Wendy Ainsworth. She was actually the very first person to log on besides myself and Kelly. We obviously don't count. So super glad, excited for you, Wendy. We count, but we don't count for that. So be looking out for your prize to come to you, Wendy. Matt, thank you
thank you
so much for being here. We greatly appreciate you being here and all the work that you're doing with Rural Health, along with your staff. I know that Jessica and Amy are both on here, so super glad to see you guys as well. Again, we'll be doing virtual coffee breaks on the second Thursday of every month at 3 o'clock. So please feel free to join us anytime. If anybody has any other questions or anything else they want to know about community partners or collaboration or working outside of silos, please feel free to contact me. I am still currently the chair of community partners, but I am definitely still the coalition coordinator for CSB. So if there's anybody has any questions or anything else, please let me know. And if not, then I hope you all have a wonderful rest of your afternoon. I did record this one today, so if anybody wants to see it, they can. And again, we appreciate you guys being here.
Thank you.
You guys appreciate it.
Yeah.
Enjoy this nice day.
Yes.
Thank you. Take care, everyone.
Bye, everybody.
Bye.